right, welcome everybody to the Provider Network Forum. We had not very many questions this time, but we wanted to go ahead and have a provider meeting because we had a few updates for you. I think HHS has a few updates they were going to give as well. We did get a few questions this morning. We can address some of those. Some of them we'll have to push to the next meeting just because we didn't get them until today. So with that being said, we'll get started. I'll let Margaret give her update first.
Okay, thank you, Lori. Let me check and make sure everyone can hear me.
I can hear.
Okay, great. Just a couple of updates this morning, this afternoon. I did want to just give a brief update. We currently have the HASP waiver renewal pending with CMS. Again, updates to that waiver would include some changes that we're cascading across multiple waivers and some state plan services in terms of personal care and nursing. We are requesting to consolidate those services. So personal care, we currently have a level 1 and a level 2. What we are going to be doing is consolidating into a singular personal care service. Also with nursing, we currently have those outlined for RN and LPN nurses. We are going to be consolidating those into one combined nursing service. That is from input from provider networks that provide those services to help with some administrative streamlining. An example would be if an individual has a plan of care that would allow for an LPN to staff the hours as opposed to an RN, the provider will have latitude to staff it per the Nurse Practice Act and scope of practice, of course, but would help alleviate the need to request a new service authorization to make that change. So that is an example. Within the HASP waiver, we are also removing the age limit from the eligibility criteria. We have increased the reserve capacity numbers to help address the capacity with that waiver. Again, since this is a renewal, we have updated the quality performance measures throughout to align with the other DDSN operated waivers. And then also updated Appendix I and Appendix J, which have to do with rate methodology and our cost to update based on the rate actions that we have taken throughout the past year and a half. We also have submitted multiple waiver amendments to consolidate those personal care and nursing services. We have also proposed to update our primary or family caregiver policy. This applies to self-directed services only, but would allow for primary caregivers that are not legally responsible adults to be reimbursed for those services. Again, it's only for self-directed services and would not apply to certain situations such as of minors, which they would typically be a legally responsible adult. Again, those changes are pending with CMS. We've had our first call with them, so we're looking forward to responding to any questions they may have about the waiver updates. Also, by way of update, there will be a bulletin routing soon, actually two that will impact providers. One, an update on the Appendix K flexibilities, any of those that will be continued or evaluated, and those that will be ending no later than 6 months after the end of the federal public health emergency. Again, the end of the PHE, federal PHE, is May 11th. Appendix K flexibilities do allow for a 6-month period. We'll be working closely with DDSN on the timing of those unwinding actions, but did want to let everyone know that a bulletin is routing for review and should be out soon. We will also be issuing a bulletin to update some of our policies related to certain durable medical equipment and authorizations. So I want to make mention of this so you start to hear what we have been working on. This is a requirement of the home health final rule that CMS issued. Our first phase, we're doing this in phases. So our first phase includes moving some equipment that traditionally has been covered under the waiver to state plan DME. That includes bath safety equipment such as raised toilet seats, transfer shower benches, shower chairs, and similar items. We will be having a full communication plan on this. The bulletin will be the first out on this phase of equipment and what that means in terms of authorization for the services, but wanted to give y'all advance notice that communication, training, and all of those items will be coming out along with it. All right. We did have, I think there's a question that may come up in terms of ICF, community ICF direct billing. We did have a working session end of last week with PDSN, mapping out the current process as is process with PDSN billing and the process that we have mapped for HHS. So we will be working through the project plan for that with more finite timeframes, but we've gathered the bulk of information and tasks we need to put that project plan together. So we're continuing to work on that. Those were my updates for today. I do see one question in the Q&A box. The question is when will HHS do a second poll for the retro payments for billing submitted after 12/31? I will be happy to take that question to our finance folks who can assist. So I'll be glad to take that. Those were my updates. Thank you, Lori.
Thanks, Margaret. The next item on the agenda is around conflict-free case management. As you guys know, we're in the last year of deconflicting all of our case management cases. We have about 1,700 more cases to deconflict. It's about 29% as of the 1st of February. Those cases, we sent out a communication to all case management providers in February that included kind of a location map of where all those cases are. We're going to start doing some more targeted work because they're very localized to specific providers. We have had some capacity issues in case management around some of the more complex cases. So we're trying to address this while not having issues with capacity at the same time. But for those of you who still have a number of cases to deconflict, you know, please just be looking for a communication from us. We want to know how we can help. You know, the last thing that we want to do is providers to try to unload 100 cases in December, right? Because that's going to really cause some capacity issues. So we're going to start working with you, try to make sure that we have a plan between now and December to get everything moved to a new provider. That's really all I had on that. So I think Quincy, you're next related to financial updates.
Yes, so we had one question come in that said, what's the latest news regarding the proviso on the old 95%, 98% of the rules that apply to the capitated and non-capitated payments? And they wanted to know if does it appear that it will be deleted by the end of the fiscal year. So after looking at the House version and the Senate version of the Appropriations Act, Proviso 3613 has been deleted in both versions. So they just have to finish up the budget process, and as of July 1, that proviso will be deleted. So that is the only update I have for today.
All right, the next item on the agenda is also mine around the provider focus groups. So we had our first provider focus group meeting, I think it was last week, related to some capacity issues in our system. And it was actually a really good meeting. If you'll recall, we asked for 3 representatives from each of the provider associations. I had great representation. Everybody participated really well. We talked about everything from access issues in case management to residential to these complex cases that are kind of out there and how to address them. We're going to be meeting again. We really shared a lot of ideas about how people are doing things in their locations, but it seems like one of the biggest issues that came up over and over again was the availability of staffing, right? That's kind of the root of it all. People are having trouble hiring and retaining staff. So, you know, we're going to try to think through and brainstorm some ways that DDSN might be able to assist in that capacity, looking at where we can streamline things on our end to help make things a little easier for you. The focus group is probably going to get back together in the next couple of weeks, and I will keep you guys posted on everything that we have going on with that. So,
Hey, Lori,
yeah.
I got a message that it may still be my Jumbotron face showing on the screen for participants instead of the conference room.
Oh, I don't know why that is, Preston. We have our IT guy in here. We'll try to get your Jumbotron face off of the computer.
Doesn't bother me, but it might bother the crowd. Thank you.
All right, I think we just took over. All right, next up is Janet.
So last week or week before, I think it was week before last, DDSN sent out a solicitation to all residential habilitation providers. The solicitation really just kind of spelled out a need that we have for at least 12 beds to serve people who are younger than we are typically serving in residential habilitation settings. We are looking for providers, or hoping that providers will come forward with some proposals. If we get proposals that are sound proposals for more than 12 beds, we're certainly willing to entertain it. I've talked with Quincy several times about the proposal, the different kinds of things that might be funded. I think the biggest takeaway is that DDSN's participation in this is really limited to one-time funding in order to help get something standing. And what that one-time funding can be is really up to you in terms of what you propose. If you're willing to propose something, we're listening to anything. If the truth is that you would like to start a different setting for people who are currently supported in order to make room for other people, we will hear that as well. Typically with the younger folks, we think about CTH2, but we're open to other kinds of proposals. So we're open to them. I think the deadline may be this Friday.
30th.
Or it's the 30th, yeah.
That's
The 30th of April. So if you have not seen it, if you need it, just reach out to me. I'll get you a copy of it. You would have gotten it, or the executive director of your agency would have gotten it from Christy Lingard a couple of weeks ago. So if you wanted to search for that, or if you have any questions or need any information, you can contact me or Harley Davis here, and we're happy to answer questions. So that's that one.
So there's a comment about that, and it's around the deadline to open the new homes is one of the things that's preventing people from applying. It's hard to say you can accept people with no ability to discharge before we see any data on the people, right? So I think there's kind of this whole,
Yeah, I got it. I understand that. As soon as there are people that we have in mind, there's information about those people that we are in the process of gathering. Obviously, we would have to de-identify the people to maintain their privacy, but we can pull out and try to give some general information about those people who are supported.
And I'll say that I did provide this to one provider who asked a similar question. So if it would be helpful to share it with, share it more widely, that general information, just to give you an idea of, males and females and ages of the different males and females and some of the needs that they have.
Yeah, the people who are on our radar, there are 11, there are 3 females. The remainder of them are males. So that we know for sure. More specific information, such as how many people have behavior support plans, how many people take behavior, medication for behavior control, those kinds of things, we'll gather as soon as we get it.
the other thing, there's a question out here about whether the people can be moved or whether that we're asking them to provide at the locations where they are. I think the answer to that is the people must be moved.
Correct.
There will not be an option to serve them in place. So I think that's that is kind of the idea of the proposal. What can we do to
Right.
help you have a place to put these people?
And the truth is that the service start date, I think it was August 1st, is ambitious. But if August 1st is not viable for you, then propose something different.
Yeah.
Again, we're interested in proposals, and we will negotiate whatever we have to regarding the specifics of the proposals.
I think that's the other thing is we have obviously people in mind, but if we get more than one proposal, there are plenty of people, right?
Yes, we have lots
So,
of people.
right, and those people might not be on as ambitious at a time.
Right.
Right,
Exactly.
so we're interested in seeing proposals from people about, what they could do to help serve that population. We just don't have a lot of availability for that age, and they're popping up everywhere. There's a question about the submission deadline. I guess the 30th is a Sunday. So does that defer the deadline to Monday, or does it stand as a Sunday?
I'm fine until Monday.
Yeah.
Sure.
Yeah.
That sounds good. I don't think we checked the actual date of what the last day of April was. We just wanted to expedite receipt of proposal. So sure, Monday, close of business.
Well, and to be honest, by 8:30 on Monday, we will not, 8:30 on the first day of May, we will not have finished reviewing all of the proposals.
Right.
So if you get it in before we finish reviewing what we receive, we'll take it.
Then there's a question about whether they have to be served in a specific city. There's not any specification to that. I think the specification is around relationship with an education system because they are people of the age where they need educational services. So we're looking
Yeah.
for kind of a relationship or a way to build a relationship with kind of school district.
Well, and sometimes it would be, if one provider came forward and said, yes, we can do this for 12, 15, 20 people, that would be great. But adding 20 special education students to a single school district sometimes is not overly well received. We would like to try to help, for the benefit of the school-age children, to be able to at least start the new school year in the district and not move in the middle.
Okay, I think that's all the questions. So, Anne, you are up next.
Okay, so I just have a couple of things today. First of all, I'd like to mention that the National Core Indicator Surveys are well underway at this point. We have Alliant going out conducting the in-person interviews among provider agencies, and we also have the Staff Stability Survey, which is recently kicked off. So we appreciate your assistance in working with us on both of these survey processes. The bigger issue that I wanted to talk about today is a new directive that will be sent to you hopefully this afternoon, possibly in the morning. And that is a significant revision to our prior abuse, neglect, and exploitation, critical incident, and death reporting process. We will have a singular incident management directive going forward. And this is something that I've talked about with different groups for a while now. When you receive this information, I encourage you to read it, reread it, and allow some time to digest the information, because there are some pretty significant changes. There is an expanded scope for reports, which will include incidents and events which occur in community-based settings, whereas previously our reports were focused on incidents and allegations that took place in DDSN-operated settings or during the provision of a waiver service. We will also have expanded definitions for some of the incident types. So again, it's a lot of information. Please take the time to review it, share it with your staff who work in quality management, those who are completing incident management reports. The comments will be due back to us on May 9th. So thank you.
All right, Harley, you're up.
Okay, so I just have a few updates. Some are related to communication, some are a little bit broader and sort of a catch-all category that I think is helpful to just include at the end. So, so moving forward, we're going to ask that questions for this meeting be submitted by the Friday before the meeting. This just allows us ample time to be able to respond to the questions. Like Lori said, some of them we just weren't able to respond to because they're going to take more time. And so having a little bit more of a feel for what topics and types of questions we're going to need to address will just help us from a planning perspective. So again, you can send them anytime to the forum agenda email address. And if we get them after that deadline, we'll just hold them till the next monthly meeting. So we appreciate y'all being cognizant of our time. We understand that you know, everybody is busy, so we appreciate that. So for those who tuned into the commission meeting last week, Constance did provide an update on the S602 bill. As she stated, that bill moved to the House Judiciary Committee on the 4th of April, and we don't have any further updates or information on the status of that bill, but it is in Judiciary Committee in the House. The Human Service Provider Association contract question responses were sent out this past Friday morning. So I hope those team members will review those and hopefully it'll set some minds at ease, but there's also some follow-up questions that we've asked as an agency to help clarify things. And so we'll await those responses, and then we'll continue to you know, respond to any additional contract questions that y'all may have. In addition, we're meeting on a weekly basis to really start preparing and get everything finalized so that there's ample time for contract language review and approval by the providers and their leadership, as well as, of course, for the fee-for-service contracts if any changes are made, we'll coordinate with DHHS for their review and approval. So given those many layers of review, we're gonna try and get the drafted contracts out as soon as possible. And then finally, just to respond to another question that we received, we do not have any updates on a search for the state director. To date, the commission has not established the search committee, and that's part of the process, or really the start of the process for identifying a new state director. So unfortunately, we don't have anything else to share on that. That's it for me, unless you have any questions on any of those specific topics.
All right, and then we're at the point of the agenda where if there are any other questions or additional remarks that you guys might have. I will say, we have looked up Medicaid categories for all people who receive residential in anticipation of the Medicaid eligibility reviews that are getting started back this month. We've started sending out lists to residential providers of the people who are going to be reviewed. They're in categories that require Medicaid review. I'm also including the PowerPoint that was done with the training that we provided in March around Medicaid eligibility. So I just want to, at this point, I'm trying to send it to the executive director and the finance director, but I'm limited a little bit with what's in SPM. So if you're an executive director, just be on the lookout for it and get it to the people who need it. Any other questions? There's a question on here for you, Quincy. They would like for you to address the audit policy revision and the status of that.
I addressed this in the commission meeting last week that we were going to hold off on putting out an audit policy until HHS has had time to put out their cost report manual or any guidance that they are planning on putting out, as the current process is built for DDSN taking in, 40 different cost reports, looking at 40 different financial statements, combining those cost reports into one, doing the allocation in our system, and then sending it to HHS by middle of December or beginning of December. So the current procedure and process is built, and deadlines are built on that. So HHS probably has their own deadlines based on when they want cost reports sent in from you guys. So I'm not going to put out any audit policies until HHS addresses that. So once they do, then we'll make some edits to ours and send it out. So, but there are 2 policies in place right now that are still valid, but I know they're going to change, once HHS releases theirs. So.
All right, I don't see any other questions. So I'll just thank you guys for coming today. Like Harley said, please try to get us any agenda items by the Friday before the meeting. And we look forward to continuing to meet and try to provide information to you guys. All right, thanks.